Addressing Obesity and Nutrition Challenges in Low-Income Communities of Chicago. Hi everyone. My name is Arvin Wallach. Thank you for being here. Today, we will talk about obesity, particularly obesity in Chicago. Obesity is a critical public health issue disproportionately affecting low-income communities. So, what is obesity? Obesity is a medical condition characterized by an excessive amount of body fat, typically defined as having a body mass index, BMI, of 30 or higher. It increases the risk of serious health issues like heart disease, diabetes, and high blood pressure. Below is the formula for BMI. BMI equals to weight in kilograms divided by height square. This is the BMI chart for adults. Obesity BMI is 30 or above at the yellow arrow. Now why in Chicago, African American and Hispanic neighborhoods face higher obesity rates? The first reason is food deserts. According to CDC, lack grocery stores or markets that provide fresh produce and other nutritious foods, forcing residents to rely on fast food and processed items. Based on the Chicago Department of Public Health, 2021, obesity rates by neighborhood in Chicago are: Englewood is 40%. North Lawndale is 42%. Austin area is 38%. And Lincoln Park neighborhood is 22%. This is the graph to show the obesity rate in those four neighborhoods of Chicago as mentioned in previous slides. And this is the map of Chicago, portraying those four areas. Noted that Englewood is south of Chicago. So, the purpose of this presentation is to propose a solution addressing obesity and nutrition challenges. To solve a problem, we have to understand the cause. The root cause. So, let's explore the background of Chicago obesity. One of the root causes is systemic racism, redlining, and urban planning policies. Redlining, a discriminatory practice, systematically denied certain communities, often minority and low income, access to loans, housing, and investments. This led to economic underdevelopment in those neighborhoods, including a lack of supermarkets or fresh produce markets. And urban planning often prioritized wealthier areas for grocery stores, leaving low-income neighborhoods with an oversaturation of fast food outlets and convenience stores. Urban planning policies have historically allowed fast food chains and convenience stores to dominate low-income neighborhoods, making unhealthy food more accessible and affordable than fresh fruits and vegetables. Food deserts, areas with limited access to affordable and nutritious food, are prevalent in areas affected by redlining. Discriminatory urban planning may lead to poorly maintained parks, lack of recreational spaces, or unsafe environments in low-income neighborhoods, discouraging physical activity. Public transportation systems in such areas might be inadequate, making it harder to access healthier food options or fitness centers located in other neighborhoods. The second major cause is food deserts. As mentioned earlier, due to limited grocery stores and the oversaturation of fast food outlets. This is the Chicago food deserts timeline. The line is the same since 1930. The long-term economic and social effects of redlining and systemic racism have created generational cycles of poverty, limiting access to education about nutrition and healthy lifestyles. And another primary cause of Chicago's high obesity rate in low-income neighborhoods is systemic disinvestment has led to long-term health disparities. Community health assessment and facts. According to the Chicago Department of Public Health article in 2021 and the Chicago Health Atlas in 2022, high obesity prevalence correlates with low-income communities. For example, 40% in Englewood. The key contributors to the high obesity prevalence are socioeconomic status, education, and physical environment. And the children in these neighborhoods are particularly vulnerable. These are diseases related to obesity. 88% to sleep apnea, 72% to heart disease, 80% to type 2 diabetes, and so many other diseases. As an MRI tech, working in Trauma 1 hospitals, I see obese patients with multiple diseases such as heart, strokes, and cancer, and who have toes and feet amputated on a daily basis. Obesity is a very serious condition. So, how can we resolve or mitigate these problems? Chicago has several solutions. 1. Healthy Chicago 2025 aims to address obesity. It's a 5-year plan that focuses on health and racial equity, including improving access to healthy food and reducing the black-white life expectancy gap. Number 2. Community gardens and SNAP benefits improve food access and address the limitations of affordability, accessibility, and political will. Despite these great interventions and solutions, there are gaps and challenges. The biggest challenges are affordability and accessibility of nutritious foods. If the families are poor, how can they buy food? And if there are limited grocery markets in the neighborhood, how can they buy fresh, nutritious foods? Another issue that is not addressed in these solutions is limited safe spaces for physical activity. If families live in small houses, neighborhoods are not safe, limited outdoor activities, they can't exercise. Limited physical activities, too much eating, and too much couch potato will lead to obesity. And one of the biggest problems I see is insufficient regulations on unhealthy food marketing. The commercials and advertisements are too attractive. We are bombarded with these everywhere we turn. Now, let's propose some improvements and solutions. Healthy Zones program integrating urban agriculture, mobile food markets, and health education. Provide programs, classes, and seminars encouraging and educating people to grow food in urban and places. Provide and encourage incentives to mobile food markets. And very important, health education. Another idea is partnerships with schools and community centers. For example, teach children about eating healthy, nutrition, and food at a young age, in elementary school. A very interesting and beneficial intervention is focusing on culturally relevant nutritional guidance. Expand and explore the horizons of food and nutrition of different cultures and traditions. Yum! Yum! Makes me hungry. So, now, let's dive into how we can implement the plan. Step 1. Establish mobile markets and urban gardens in food deserts. Whole Foods was kind and opened a small market in Englewood to help the community have access to healthy food. My family and I lived in Oak Lawn, Illinois, which is southwest Chicago. We shopped at this Whole Foods all the time because the prices were about 25% lower than other Whole Foods. When we shopped there, the store was mostly empty because Englewood was a low-income community. Step 2. Train community health workers for educational outreach. My mother and I participated in many of these events. Work with the community centers to share healthy recipes. Teach kids and families how to grow food at home. Step 3. Advocate for policy support and tax incentives for fresh food retailers. For example, lower the taxes for farmers market retailers, local fresh food retailers, and producers. Increase the SNAP amount for low-income families and encourage farmers market to accept SNAP. With these 3 improvements, we have these expected outcomes. Increased access to nutritious food. Reduced obesity rates and improved health metrics. The lower obesity rate will lead to lower other related diseases. And empowered communities with sustainable practices. To conclude, obesity in Chicago's low-income areas is a multifaceted issue. Not one single factor contributes to it. If we address the social determinants and implement solutions, we can improve health outcomes. Collaboration among stakeholders is essential for sustainable change. Teamwork. And, by reducing obesity rates and increasing food accessibility, the Healthy Zones program empowers underserved communities.
Yeehaw!
These are references for the papers and this presentation. Thank you very much for your time and attention. Applause is allowed.